Hi, Jamie Davis from the Nursing Show here at the ANIA conference in Philadelphia. We're talking about nursing informatics, and I'm really super excited. I get to talk with Molly McCarthy, who is from Microsoft. She's the Chief Nursing Strategist for their Health and Life Sciences area, and I'm just so excited and thrilled, Molly, that nurses are being supported by more big companies like Microsoft, and that Microsoft is seeing a need to come in and help provide support to nurses.
Yeah, I think as we look at nursing across the United States, there are about 4 million nurses, and as we look worldwide at Microsoft, at healthcare workers, nurses really outnumber any other healthcare worker, for example, our physician counterparts, by about 3 to 1, and it's really important as we look towards healthcare transformation and the future health of our patients and our caregivers that we really pay attention to nurses. And part of my role at Microsoft is to really elevate the nursing voice, both within Microsoft and then out into the marketplace.
And we'll talk more about that in just a second, but I have to ask you, how did you end up at Microsoft? Tell us a little bit about your nursing journey.
Sure. So I started my nursing journey back at Georgetown University many moons ago, and I worked in both the neonatal intensive care unit and pediatric units, cardiology and kidney transplant on the East Coast and then on the West Coast. And I think, I landed in Silicon Valley, where I went back to business school because I really felt there was a need to kind of merge healthcare as well as business as we look to the future of health. And my first job after business school was with a small medical device company in Silicon Valley called Natus Medical. And I did a lot with the engineers at Natus, both software and hardware, as well as clinicians in the marketplace, and really began my career in design and development around systems that would help clinicians do their jobs better, get information to them quicker. From there, I worked for AWON, the Association of Women's Health, Obstetric and Neonatal Nurses, and really continued a lot of work around informatics, piloting a benchmarking database that would provide information to, for example, a director of women's services to help them benchmark how they compared to like hospitals, for example, on C-section rates. And this was actually mid-2000s, so it was really before I think big data was cool, right, so to speak. That landed me, from that point, I really started to see the merger of health and technology and the need to really understand that, both from a nursing perspective but business. I had an opportunity with Philips in their patient monitoring group, and again, as meaningful use came into play, taking that data at the bedside and really integrating it into the EMR. So in the future, we can use that data to really improve patient outcomes, patient experience, as well as hopefully reduce costs along the way. And Microsoft called me 2 years ago and was very excited for the opportunity to really help such a large company kind of break out into the nursing world. And so over the past year, we've really tried to gain traction amongst nurses. And we can talk more about that in a minute.
We can, absolutely, because you've got a blog out there now. You're trying to find ways to reach out and support nurses in their use of medical technology and devices. So tell us a little bit about some of the specific initiatives that you're trying to implement to support nurses at the bedside and as nurse informatics.
Sure. So I think we've got a couple different vehicles to really elevate the nursing voice. One is that nursing blog that you mentioned, and so we welcome all nurses, whether they're bedside nurses or in the boardroom, to really share their experiences on our blog in their own words. And we have 3 great blogs coming up during Nurses Week in a couple weeks. We're also launching a joint initiative with Intel. That will be more information on that on our website coming up in Nurses Week starting May 6th. we are working alongside Johns Hopkins and Under Armour. We have a special event actually at the Innovation Hub at Hopkins to celebrate nurses and everything that they do. I think, as we look back over the past few years, nurses and nursing informaticists have spent a lot of time across the country implementing EMR systems, moving to electronic documentation, and really that's really just the launching point for, I think, what comes next in healthcare and how we can use that data to improve care.
No, that's great. And I think that, it's great to see, like I said earlier, a company like Microsoft reach out and say nurses are important. Right. And nurses are integral to the healthcare system, right, and what we're doing moving forward. And I just want to thank you so much and thank Microsoft for taking that initiative.
Well, thank you. I think, in kind of wrapping this up, as we think about nurses, they truly are the link between that technology and the patient, and they're, an advocate for the patient. So I'm so happy to be part of Microsoft, and I'm happy that such a large entity is paying attention to nurses, because they're so crucial as we transform healthcare. Thank you.
Well, I thank you, and I want to thank all of you for checking this out. Remember to check out more segments like this over at NursingShow.com. We're on whatever channel you happen to be watching this video. We'll have more from ANIA and Philadelphia and Nursing Informatics coming up soon, so stay tuned.